Hey everyone, I wanted to send a quick kind of feedback video. So this is going to be something that I'm going to incorporate into some of the classes when I think that it's going to be easier for me to have a conversation with you or simply be able to kind of chat and give some general feedback. So you know that I like to give a lot of individualized feedback, but I think sometimes things are good for the class to hear as a whole. I think especially for some of the online stuff that we didn't get to cover in class quite as much, but that we wanted to talk about within the online portion of this course is going to be very important. And so last week we focused a lot on what patient-centered care is. And so I hope that you're able to see that, it's attending to the patient for whatever they need. We had some great definitions from the Institute of Medicine and the core competencies. And so you got to read within some of that information in your readings, and I'm looking forward to reading your summaries here shortly of it. I'm not going to go into tons of detail specifically about what patient-centered care is right now because I hope that some of the readings and other applications kind of did some of that. In your assignment, one thing that I do want to say to the class as a whole, I've had multiple videos that I can't hear. So they're stuttering or there's a lot of information that I can't hear. Maybe you're in a room and you're recording, which is great. But just please make sure that whenever you post a video to YouTube, that you take a second and go back and that you listen to it. So if you cannot hear the video, then that means I can't either. So please, please, please try to go back. This week I was a little bit lenient, but this is the last week. So, accidents happen where you may accidentally submit the wrong video, and that's fine. But if you submit a video that I can't hear or that I can't see or that isn't proper at this point, I am going to have to deduct some points because it's not beneficial for me to take my time to go through or for you to actually do the assignment because I can't see or hear what you're doing within the assignment. So for patient-centered care, I had you do the activity where that you watched a video online of a patient intake, and then you had to take some notes on it. Now, a few of you in the different groups have mentioned about you weren't able to get as good medical documentation down. You weren't as good to share the information between athletic trainers. That's all fine and dandy, but I want us to take a step back for a second. Whenever we think of patient-centered care, we need to focus on the patient first and foremost. What are their needs? What are their goals? What is their reason for the care? And so although the task was completing medical documentation, that wasn't where the focus of your information should be. And so I want to kind of make sure that we don't miss that mark. So a lot of you talked about the idea that we're in an athletic training facility and there are a lot of patients around and you are busy. And, we talked about it in class the other day. You're stretching somebody and then somebody comes up to talk to you and you just get further and further along to where you're stretching that person to where they can't even, handle the pressure of what you're doing. And so I want you to take a step back and think about it that way. I had you complete the notes and actually see the visible difference, but I don't really care what you necessarily wrote down. What I care about is the fact that were you listening to your patient or not? Were you going through? Were you able to hear what they had to say to the clinician? And understanding that things around us distract. If I was teaching and I had my cell phone up or I constantly looked at my watch, that would be something that you would note as a student. Well, the same thing happens if you go to a doctor's office and they're busy or they're rushing or they're talking to somebody else in the room and you feel like, hey, I'm the patient, give me some attention. And that happens, unfortunately, in athletic training all the time. And so I want to kind of stop bad habits before they ever begin with you. And so let's take a moment, go back and look at your reflection that you did. It's not necessarily wrong if you didn't focus 100% on patient-centered care, but if you didn't, you missed the mark a little bit, and so that's why we're going to have things like this feedback. So when you get this, how can you apply this to the fall? So you are going to be very busy at your clinical site, which you'll get to find out soon. So thinking about things of, maybe I can't speak with you right now, but I can talk to you in 5 minutes because I can devote my whole attention to you. Making sure that you're not distracted by other things, even though their work and their good intention, unfortunately still doesn't give the patient the best and what they need. In this video, there wasn't any big secrets. There wasn't anything surprising. But what happens if this video had some underlying cause where the patient had some sort of mental health illness and they were trying to get the healthcare provider's attention because maybe they didn't want to talk about it, but they would be willing to if it was brought up? What about the idea if they mentioned the idea about utilizing some sort of drugs or substance and they really needed help and the healthcare provider didn't catch on and maybe the patient didn't even know that was a thing? The other thing too is when you're taking patient history after you take your organization or your evaluation courses, you're going to be able to have a good idea what the injury probably is just simply by talking to the person and getting a good history. As I told you before, I taught in an online doctorate program, and one of the things, unfortunately, is that we're sometimes having to teach this to doctoral students. So I'm wanting to, with the new standards, get a early stance on you guys, get a good foundation built. But the difference in evaluations, you can have a 30-minute patient evaluation, and it's just all talking. And so I want you to keep that in mind, that patient-centered care is difficult, patient-centered care is hard, but it's what we need to strive to do. And so please make sure you go back through, take a look at what you wrote, and make sure that you know the focus on this was to understand that when you're distracted by other things, you're not going to be able to give the patients the amount of time and the attention that they deserve. If you have any questions, let me know, and I'll be happy to speak with you individually about your specific assignment. Have a good one.